Hey, hi guys. Welcome to Explore Physio, and this is the day 4 of our 30 days live session series. As we're late again, I think it's 10:13 right now, and we decided like 9 p.m. usually we will take, but today was weekend, and this was a time ki I usually go out and like, go for the things like आज in long time I went for the 3K run. 3 किलोमीटर इज अ वेरी शॉर्ट डिस्टेंस अगर हम रनिंग का डिस्टेंस की बात करें फॉर द beginners or some for other people also, but it was kind of a relief for me because I was trying for this for a long time कि ठीक है let's get into the routine और momentum में वापस जाएं, and today it happened and I think it was really great. We ran around 3 kilometers. There were around 30 to 40 people, and it was kind of a community run. मतलब there I say initiative by Sweaty Jaipur. It's kind of a running community जहाँ पे लोग join करते हैं and they run for on weekends usually. So I joined that and it was a great day overall. And yep, let's start our day 4. This is Dr. Jatin here, and we'll be discussing some new things today. Like मैं कुछ बुक्स जिसने मुझे बहुत हेल्प किया इन टर्म्स ऑफ अंडरस्टैंडिंग पेन, फिजियोथेरेपी और हाउ ह्यूमन बॉडी इज सो अमेजिंग इन टर्म्स ऑफ हैंडलिंग पेन और moving to the recovery processes once you are injured. These two books I'm going to share at the end of the session. Secondly, we'll discuss some posts like which I resonated. Like so there are some pages on the Instagram who are really doing great job in terms of putting out their words and keeping things simple also, but at the same time effective and uh, reasonable, I will say, in terms of disseminating information. क्योंकि होता क्या है जब आप information put out करना चाहते हो out in the social media or anywhere, you need to be particular about what you're sharing, because it will reach to hundreds of millions of people. It may get viral, but you as a healthcare professional, you have some responsibility in sharing things which are really making the difference. So kuch posts I think jo they are really making a difference in how the people think about pain और किस तरह से पेन को एक परसीव किया जाता है सोशल नॉर्म. आई थिंक these people are really doing it. I think we'll discuss that also in the meantime. So let's start with that. I think उसके साथ साथ हम धीरे धीरे will come on the topics also कि हम कहाँ डिटेल में डिस्कस कर सकते हैं. But yeah, let's start our session by this. Yeah, great. I hope you're able to see my screen. So he's I think he's Ashish the physiotherapy, or he's posting peaceful and along with that advices or from his experience or इनका जो एक तरह से routine है, like he's really active recently in the physio space, but he has shared so many good influential posts in recent times. So I thought that let's talk around this so that हम इसमें से कुछ अच्छा सा सीख सकें, and I think we can put out at this or amplify this information more. So this was about low back pain, what most people misunderstand about back pain. In practice also, I've seen like more of the cases like people are coming for the low back pain or knee pain. These two kind of pain are really common. Okay, and in दोनों pains के around भी जो बातें हैं या जो myths हैं वो बहुत बढ़ चढ़ के रहते हैं. अभी कल ही मैं कंसल्टेशन ले रहा था, एंड कंसल्टेशन वाज फॉर अ पर्सन वो मतलब जो एक साड़ी की शॉप पे काम करते थे, एंड सरप्राइजिंगली उन्होंने टेली कंसल्टेशन लिया, एंड आई वाज नॉट एक्सपेक्टिंग दैट नाउ दिस इज रीचिंग टू सो डीपर पार्ट ऑफ आवर सोसाइटीज ऑल्सो, कि पीपल आर थिंकिंग दैट ये भी एक ऑप्शन हो सकता है टू गेट केयर, एंड दैट इज आई थिंक वेरी बिग स्टेप इन आवर हेल्थ केयर सिस्टम when people are choosing accessible, more affordable options over other factors. ठीक है, तो person he was from I think Uttar Pradesh, and very like from a very small village. उनकी एक साड़ी की शॉप थी, and he was around 28, I think, year of age. बैक पेन वॉज देयर फ्रॉम लास्ट 3 to 4 years, ठीक है, 3 से 4 सालों से उनको बैक पेन था. उनका कंसर्न था कि ही वाज नॉट एबल टू बैंड, ही वाज नॉट एबल टू डू वर्क वेरी वेल. इट वाज एपिसोडिक इन नेचर, कभी होता था कभी नहीं होता था पेन, बट जिस दिन होता था इट वाज वेरी सीवियर इन द नेचर, एंड स्लोली ग्रेजुअली इट गेट्स बेटर आल्सो. सो एक कॉमन जो थीम एक प्रेजेंट होता है मोस्ट ऑफ द लो बैक पेन केसेस में, अगर हम येलो फ्लेक्स और रेड फ्लेक्स को हटा दें तो इट गेट्स बेटर इन इट्स नेचुरल हिस्ट्री. इट हैज सम नेचुरल हिस्ट्री जिसके अराउंड वो ठीक हो जाता है. अगर आप के बाकी फैक्टर्स, वो कहते हैं ना, देयर आर सम मेनी मूविंग पीसेस इन द पजल, अगर बाकी फैक्टर्स अच्छे हैं तो योर पेन विल गेट बेटर. ओके, पेन इज समथिंग व्हिच इज वेरी मल्टीफैक्टोरियल इन नेचर. तो अगर आप एक एक पीस को छोड़ के बाकी पीस पे भी काम करते हैं, व्हिच पीपल डू not consciously but because उनका routine होता है, they have societal support, they have like the economic जो part होता है, financial part होता है, that is, there are many things which really affect a back pain. He was having that thing from last 3 to 4 years, not able to recover. उनका जो एक उन्होंने वाकया जो बताया मुझे, एक्सपीरियंस अपना जो बताया, उन्होंने बोला कि मेरे को बैक पेन था, मैंने बहुत चीजें ट्राई की, मैंने आयुर्वेदिक भी ट्राई किया, मैंने होम्योपैथिक ट्राई किया, और मैं रिसेंटली एक वैद्य के पास गया था. उन्होंने मुझे लात मारी लेटा के पीठ के ऊपर 2 या 3 बार, और उन्होंने बोला कि इससे ठीक हो जाएगा. तो मैंने वो ट्राई किया और मुझे बहुत अच्छा लगा. 1 घंटे में अच्छा लगा, फिर दूसरे घंटे में थोड़ा पेन बढ़ा, और तीसरे घंटे में वापस वैसा हो गया. बट हाँ, मुझे आराम मिला. तो अल्टीमेटली दैट वाज अ कंसल्टेशन कॉल. आई ट्राइड माय बेस्ट कि किस तरह से उनको समझाया जाए, कि या समझाने की बजाय उनको एक रास्ता दिखाया जाए कि ठीक है, आपने जो चूज किया दैट वाज काइंड ऑफ अ थिंग, कि हम उसमें कुछ ज्यादा चीज नहीं कर सकते हैं. मतलब हम उसको आपके पास जो अवेलेबल ऑप्शंस होते हैं, आप वहां से ही कुछ चीजें चूज करते हो. तो अगर आपके पास ऑप्शन नहीं है तो आपकी भी गलती नहीं है कि यू आर नॉट नोइंग कि क्या अच्छा है क्या बुरा है. आपको लगा कि ये, उन्होंने एक और बात बोली मुझे, आई थिंक दैट इज वेरी कॉमन इन आवर फील्ड और आवर प्रोफेशन, और स्पेशली पीपल विद द पेन, दे आर इन होप टू गेट अ क्विक रिजल्ट. उनको अगर कोई बोलता है कि आप मेरे पास आइए, मैं आपका पेन ठीक कर सकता हूँ, जल्दी से जल्दी ठीक कर सकता हूँ, आप चाहे कितना ही उनको एविडेंस बेस्ड इंफॉर्मेशन दे दो, वो नहीं आने वाले आपके पास. ठीक है, दे विल गो वेयर देयर इज अ लेस फ्रिक्शन, देयर इज मोर, दैट इज मोर क्लोजर टू देयर ड्रीम आउटकम. जितना जल्दी उनको वो अचीव हो सकता है, आई थिंक दैट विल दे विल गो फॉर इट. ही सेड, सर वहां पे बहुत लोग जाते हैं, बहुत लोग ठीक होते हैं, इसलिए मैं वहां पे गया. And I was like कि ठीक है, sometimes it's very challenging, or some very much of friction in terms of communication, but people understand. Trust me, if any physio is watching this video, many people say कि sir, Jatin, हम या फिर like when I talk to juniors or any colleague also, कि हमारे पास ऑप्शन नहीं होता है. अगर हम क्लिनिक पे पेशेंट आता है, हमको वो बोलते हैं हमको कपिंग चाहिए, हमको नीडलिंग चाहिए, हम बोल नहीं पाते हमको कि हम दिस इज नॉट हाउ इट वर्क्स, क्योंकि उनके वो डिमांड रहता है. ट्रस्ट मी, अगर आप उनको उनके कंसर्न को समझते हुए, उनके जो बिलीव्स है उनको समझते हुए, डू नॉट कन्फ्रंट देम, बट गिव देम एन ऑप्शन एटलीस्ट टू चूज. आप अगर ऑप्शन ही नहीं देंगे तो आई थिंक इट विल नॉट मैटर कि आप कितना अच्छा उनको ट्रीटमेंट दे रहे हो, कितना अच्छा उनको फील करा रहे हैं. दैट इज नॉट द रियल पाथ. यू आर डिलेइंग दैट रिकवरी, आई विल से आउटकम इटसेल्फ. तो yep, I tried my best. He was convinced for the things ki theek hai, it can be done. Maybe he will be coming future, but he was more of comforted about the things. I did the screening part and I told him this is not scary. You do not need to go for surgery. He was trying to go for a surgery also, and most of the back pain do not require surgery in the case. लेकिन लोगों को लगता है one more thing, that पैथो एनाटॉमिकल जो एक डायग्नोसिस होते हैं फॉर मोस्ट ऑफ फिजिशियन ऑल्सो, कि आपका डिस्क बल्ज बाहर आ गया है, डिस्क बाहर आ गया है, उसको हम सर्जरी के थ्रू अंदर डाल देंगे. वेरी वेरी plausible explanation, but not really that's how our body works. ठीक है, डिस्क इज नॉट समथिंग लाइक स्क्यूजी थिंग कि जो आप प्रेस करोगे वो बाहर निकल जाएगा. आई गिव एन एग्जांपल. पीपल अंडरस्टैंड विद स्टोरीज. आप उनको एनेक्डोट्स या फिर आप उनको जो स्टोरी समझ में आता है, उनका जो कंस्ट्रक्ट है माइंड का, उसके थ्रू अगर समझाओगे वो समझते हैं. ठीक है, आई गिव हिम वन वेरी लाइक ऑप्टिमिस्टिक एग्जांपल ऑफ मूवमेंट, कि if you have seen people in your village, आपने अगर गांव में अपने लोगों को देखा है जहाँ पे लोग खेती करते हैं, जहाँ पे लोग दिन भर बैंड होके काम करते हैं और वो अच्छी लाइफ जीते हैं, कभी बैक पेन होता है ठीक है वो चल जाता है, बट आप उनका डेली लाइफस्टाइल देखिए कितना अच्छे से वो लोग काम कर पाते हैं. I'm not saying कि people who are doing labor work they don't have back pain. They have back pain, but human body is so adaptable. It can adapt into very various of postures. It can adapt to various of activities, and I think that is the beauty of human body also. He was convinced again, and I gave him one more example from my perspective. I told him I also live in a village, and I am seeing people here around 85 climbing a tree and doing all the works. They don't have any issues. ठीक है, आप movement कर सकते हो. There is no fear in that. Of course, I took the screening part. It's not for every back pain case. Disclaimer is that there, but screening is important. Finding down red flags and green flag, yellow flags are important, and then slowly graded exposure of movement is that is a paramount thing we need to go for a back pain. Let's get back to the topic जो हम discuss कर रहे थे, or the post itself. First thing, I think this is about what most people misunderstand about back pain. Most back pain isn't caused by damage. True. Sometimes, like I was reading a paper recently, I couldn't cite because I didn't prepare it, of course, but most of the back pain जो होते हैं आपको ऐसी एक्टिविटीज में होते हैं जो डिमांडिंग नहीं होती है. आपने सुना होगा if you are a physiotherapist or if you are a normal person, like general people from general population also, बहुत हद तक बैक पेन ऐसी कंडीशन में होते हैं जो आप दिन भर आप रेगुलर करते आते हैं, बाल्टी उठाने में, या फिर आप नीचे झुक के कुछ आप झाड़ू लगा रहे हैं, या फिर आप सुबह सुबह उठे और एकदम से चेंज किया पोजीशन एंड यू फेल्ट दैट ओके देयर इज समथिंग रॉन्ग इन योर बैक. ठीक है, आपने कहीं ना कहीं बैक पेन एक्सपीरियंस किया होगा, एंड दोज आर द एक्टिविटीज व्हिच आर नॉर्मली यूजुअल टू योर डेली लाइफ. बट इट डजंट मीन अगर आपको बैक पेन हो रहा है कि इट्स ऑलवेज अ डैमेज इन योर बॉडी. Okay, there are multiple reasons, there are multiple factors which affects the pain, and most of the time it is not caused by damage. It is your body asking for change, not repair. True, I think आपने observe किया होगा whenever you are feeling very down, or whenever you are not, like, see, the major contributors are always your lifestyle factors, your sleep, your stress, the economical background also. Your movement, sedentary people do have more chances of getting back pain. There are multiple things. I think the unusual movements which you have not done in a long time, that may be one reason, but yep, this is not the primary reason. Okay, that there is no need to be afraid of movement. It's asking for some change, not repair itself. Okay, you need to alter your activity a little bit. You need to go back to the basics and then start again. Walking is the best that you can go for. Like we can give any back pain patient, try to let them move again. Scans can look scary even in the people without pain. Again, diagnostic or जो भी scans होते हैं, they are of a really great clinical use most of the time, but in the back pain cases they are overly utilized, they are overly prescribed by many reasons, either because of financial, that capitalism which is involved, or that I'll say that model of healthcare jahan pe we are trying to fix something, we are trying to be that person who is fixing things by their own all means. ठीक है, वो जो god like figure हम समझते हैं as a patient also, like the doctor can heal everything. Okay, and the scan is one more thing which people usually show and say that okay, यहाँ पे देखो आपको ये bulge हो रखा है, इसकी वजह से आपको ये हो रखा और पेन इसकी वजह से आपको हो रहा है, but that is not really that simple. Okay, they can look scary, but even if you take people scan in the people who are really normal, you will see all these bulges in the spine also. So nothing to worry. It may look scary. Again, how you explain those things, okay? How you give that assurance to people that it's okay to move, that really matters most. Pain doesn't always mean something is wrong. Okay, pain is very complex. Okay, pain is very amazing also. I will give you two books जो आप please go and read. If you are a general from general population also, if you are a physio also, whether you are a new grade or professional, I recommend these two books. Really go and read, I think, and that will give you more of understanding कि किस तरह से आप चीजों को बहुत अलग तरीके से समझ सकते हैं, जान सकते हैं. And yeah, I will disclose the name at the end, so you watch this video at least till the end itself. But yeah, let's move ahead. It's not pain is pain and nociception, they are two different things. मैं बिल्कुल एक आसान भाषा में समझाने की कोशिश करूंगा इस कॉन्सेप्ट को, because I think it's very important to understand how it differ. Human body has multiple survival mechanism. Its primary objective is to save this structure. ठीक है. Now from evolution, हमारा जो बॉडी है, हमारा जो फिजियोलॉजिकल सिस्टम है, वो इवॉल्व हुआ है ऑन सर्टेन बेसिस कि हाउ वी कैन every cell, every organism in this earth is trying to save itself and spread its progeny. Okay, this is the primary objective of the life. Like we can say that evolution theory of evolution says that the survival of the fittest is the best. Like those who will adapt, those who will live long, those who will able to spread their progeny will grow as a species. Okay, pain is one something which has evolved in humans or in the most of the creatures, or which are like either mammals or like other insects. Every insects have their defensive mechanism or to protect themselves. Pain is one thing which has evolved in the nature. फिजियोलॉजिकल सिस्टम की अगर बात करें तो आपके जो रिसेप्टर्स होते हैं, नोसिसेप्टर्स होते हैं. नोसिसेप्टर्स कैन बी मल्टी मॉडल ऑल्सो. आपके जो पेन रिसेप्टर्स हैं, सॉरी नॉट पेन रिसेप्टर्स, नोसिसेप्टर्स हैं, जो आपके थर्मो रिसेप्टर्स हैं, जो आपको टेम्परेचर का सेंस देते हैं, जो आपके प्रेशर रिसेप्टर्स हैं, बैरो रिसेप्टर्स हैं, they can all act as a nociception. ठीक है. We have nociceptors also, free nerve endings and everything, but it's very very complex in nature. Simple as that, they work as an alarm. Alarm doesn't always means there is something scary. ठीक है. Pain आपको जब आप I will give you a simple example, and it is from the book itself, the Explain Pain. Some of the situation for a violinist, अगर आप एक violinist हो, अगर आपके fingers बहुत important है, ठीक है. If you get an stick or anything in your finger, you will feel more of pain because that is more meaningful for you. आपने observe किया वो कभी आप गर्म किसी चीज को छूते हैं तो there is a sudden reflex. That is kind of a nociception. You are able to protect yourself from some harmful stimuli. ठीक है. But how you perceive that, अगर आपको बोला जाए कि आपको 5 से 10 सेकंड उसको होल्ड करना है, people will be able to overcome that and people will be able to hold that, because now the pain is controlled by central nervous system. Pain is always in your brain. It doesn't mean that it is not real, but it is always given meaning in your brain. The signals from that any part which is exposed to stimuli goes to your central nervous system through your spine, like nerves, through spinal cord, and then to different centers. And there are multiple centers which combine together and give the meaning. What does it really mean? And then you have the feeling of pain or that emotional, that experience of pain. If we go for the, if I give you the definition by IASP, that is International Association of Pain, that says pain is a sensory and emotional experience, which is like, I'll share it. I think that is much better way of seeing things. So give me a second. I will share you that part and I think we can discuss through that. Okay, so yep, I think it's visible now. It's not able to show my screen. What is happening? Okay, give me a second. I think it's not showing up the screen. But yeah, we'll go back to the thing. So pain is a sensory and emotional experience which may be present in if there is a stimuli or if there is no stimuli also. It may present in absence of any tissue injury or actual or potential damage also. So that is what pain is, and it's very complex in nature. But kind of is very simple also if you are able to explain it. Okay. So yeah, we'll go for this again. It doesn't mean always there is something wrong. You need to identify it, you need to accept it, and you need to, मतलब एक मैंने बहुत अच्छा कोट सा पढ़ा था, कोट था, there was statement, pain is always in a pit stop. It gives you an attention that okay, there's something needs to be changed, there's something needs to be done. What needs to be done, you can decide. Okay, always पेन है, मूव नहीं करना है, इट्स ओके, बट कब तक मूव नहीं करना है, यू नीड टू बी क्लियर. Pain doesn't mean that every time you will do that movement you will have more damage or more injury. Pain is always not equal to damage, simple as that. It's an sensation, it's an emotional experience. You may feel debilitating, but there is a there is a good hope, or there is a good chance you will get better in most of the time, or most of the situation itself. Rest isn't always best, and movement is the medicine. That is how the notion is changing, and I'm pretty much sure we will move this towards this as a community also. Ki people should not recommend, or people should not incline towards rest itself, क्योंकि movement is very integral to human body. आप देखेंगे अगर आप physiotherapist है, most of the patients which come, they have so many beliefs regarding movement. अगर ये बेंडिंग मैं करूंगा सर पेन हो जाएगा, अगर मुझे डॉक्टर ने मना किया है आप बैंड नहीं करना, समटाइम्स दे शो द प्रिस्क्रिप्शन, सर देखिए people have written that don't bend, don't lift, don't move, don't walk also, and it is not written until until when, basically कितना टाइम तक हम नहीं करना है. They just said it, and we were following it very religiously, but that's why it is very debilitating. That's why the health system is very broken, I'll say. I saw a patient who was not bending from 4 to 5 years, and he or she was doing just solely because someone told her that do not bend. Okay, so yeah, rest is not always best, and movement is the medicine. If they given in correct, like if there is no if not bad, something is always better than nothing. If you are doing nothing, start with something and then gradually increase it. That's how you get better with the movement. Posture isn't the villain, fear and overload are. Again, the posture, there is a huge debate कि कौन सा posture अच्छा है, कौन सा posture अच्छा नहीं है. I will say it's not about posture, it's about fear. It's about underloading or overloading the tissues. You are not loading your body in certain movements, and suddenly you are spending more of time, more of duration in those kind of movements. You may feel some uneasiness, and I think that is a sign. Again, you need to load your body, or if you're overloading it, I think those things are really the major factor which really prevent people from moving itself. Okay, finding the correct amount of baseline, finding the correct amount of entry point, कहाँ से हम entry कर सकते हैं. So that is, I think, where things get trickier. But yeah, you are not just broken, you are just buffering. Buffering means you are trying to find your option, and again, yeah, that's all. I think this is what I wanted to discuss with this post, and this was something which I resonated with. Kind of an random thing, but that's how I think we're gonna grow. That's why we move, at least for these 30 days. I will try to work around something different things, or try to stick to something else also, maybe. But it will be kind of more dynamic in nature. आज एक I went to a clinic also. He's my good friend Sunil Doi, and वहाँ पे हमने एक राउंड टेबल डिस्कशन सा क्रिएट किया, जहाँ पे we were talking about physiotherapy, we are talking about how things are evolving in like people spoke from their experiences. उन्होंने अपने खुद का जो उनका एक्सपीरियंस था, पर्सनल एक्सपीरियंस, उन्होंने वो शेयर किया, एंड इट वाज अ काइंड ऑफ लॉन्ग डिस्कशन, 1 hour itself. होपफुली विल सी दैट अगर हम वो भी शेयर कर सकते हैं और इस चैनल के ऊपर. आई विल आस्क सुनील टू शेयर दैट आल्सो. He is running his own clinic, the Rebalance Physiotherapy Clinic, and I think he will do really great future. He's doing great really now also, and he will do great in the future also. So yep, time to see the books. I think that's where we can go now, and we can see 2 books which I recommend everyone to read who is in physiotherapy or not in physiotherapy also. Everyone should read this and get the best out of it. ठीक है. First book is The Recovery Strategies Pain Guidebook by Dr. Greg Lehman. इनका X के ऊपर अकाउंट है, इनका Instagram पे अकाउंट है. He has done a lot of work on strength and conditioning. He's a physio, I think, and he has done amazing job in simplifying thing and towards the movement optimism. Basically, इनका एक खुद का I think website भी है, movement optimism करके. And this is the one book I think I would recommend everyone to go with. Recovery Strategies Pain Guidebook. If you are watching this video, if you are able to find it, all good. If you're not able to find it, drop me a text, just contact me. I will send you the PDF and I think we can read it anyways. So इसके अंदर ये पेशेंट्स के लिए भी है, ये थेरेपिस्ट के लिए भी है. दिस इज फॉर एवरीवन. सिंपल, crisp, with the clarity, what is pain, how you can recover with this. अगर आपको ये जानना है कि आपको पेन है और आप किस तरह से इसे improve कर सकते हो, go with this one book. It will give you lot many tools to reflect on your pain and how you can get better with the pain itself. ठीक है. This is the first book I will recommend, and short book, ज़्यादा बड़ा book नहीं है. I think 71 pages का है, but must read for everyone. Second book, which is more of kind of a story oriented, it's Explain Pain by David Butler, Lorimer Mosley. Two big names in pain science, two big names in pain physiology. They have done ton of work in pain physiology and in giving understanding how pain really works. So everyone should go with their through with their work. Abhi inhone recently these two books, Explain Pain and Explain Pain Supercharged. I think this is very detailed in nature. इन्होंने pain physiology के बारे में बात की. This one is more about stories from people experience, pain physiology simplified, and how you can understand it in very simple and within a story manner. ठीक है. अगर आप जानना चाहते हो, समझना चाहते हो, I think this is one good book you can read again. Explain Pain. I usually recommend this to most of the people I treat so that उनको एक understanding हो और उनको समझ में आए कि किस तरह से. There is one very good infographic I think at the end itself. Let me see if we can find it. That is really great. So there are many graphs. जैसे ये graph है regarding the pain onset and how you really go with the things. कि अगर pain I think it will take time, but yeah, let's move to this one. This is a really great infographic, I will say, for in respect to how a person after injury moves with the pain experiences, their anxiety down. If you really don't take move away from it, अगर आप वहां से नहीं निकल पाते हो, then you catastrophize on thing. फिर आप बहुत सारे sea of endless professionals आप हर जगह दिखाते हो, आप चाहते हो कि मेरे को कहीं ना कहीं से इसका इलाज मिल जाए, but again you go in a fear village जहाँ पे आपको और fear बढ़ता है. Then you go in a lake of evidence. मतलब आप avoid करने लगते हो activities को, आप काम नहीं करते हो, आप अपने movement को restrict करते हो. That is avoidancity. Now you are in a valley of disuse, depression, disability. You are nowhere. And then this is a pathway to re-injury. So see, this is how things work. Very simple infographic, but explains a lot about the pain experience. Now there is another pathway. If you there's a comprehension pathway, there is a little fear. You are understanding it, what needs to be done. The person is injured, but he's trying to play, going through that some bravery corners. Bravery corners also there are ups and downs. आपको पेन कभी है, फ्लेयर अप है, कभी नहीं है, but you are trying to find something which you are able to do. ठीक है. And now that is the road to recovery. And now when you understand it, when you confront it, that is a pathway to well-being. Well-being, in my concern, in my understanding, is more about getting independent, getting an understanding of things. When you understand something, you are empowered. And when you are empowered, you can take more better decision for yourself also and for your people around you also. So yeah, that's all. I will leave you with these two good books. The first one is the Explain Pain by David Butler and Lorimer Mosley. Second is Recovery Strategies by Greg Lehman. Do follow Ashish Stay Physiotherapy. I think he's doing a really great job. I will bring more people like these, or post from people like this, so which I found really valuable. And yeah, that's all. I think we are done with another session. It was a great joy to share all the things, and we'll come back again tomorrow, maybe around 9 p.m. again. I will try to stick to the time. Today was exception, but we'll stick to the time again. And yeah, take care, have a great sleep, and take care of yourself, take care of people around you, learn about things, and we'll meet again tomorrow. See you. Bye bye.